Now that we have seen a little about the future of work, it is a good time to look into the future of health. AI is already revolutionizing the field of medicine, drug development, and discovering and patient care. Are we truly heading towards a healthier or even perhaps a disease-free world? What are the challenges and opportunities in that path? I invite our great panelists, Gabriela Pravetoni, Director, Applied Research Unit for Cognitive and Psychological Science, IEO Italy, Dennis Horgan, EAPM Executive Director, Belgium, Nuria Malatz, Head Genetic and Molecular Epidemiology Group, CNIO Spain, Michael Strubin, Director, Digital Health, MedTech Europe, Belgium, Yasmina Koeva-Balabanova, Chair of the Board of Bulgaria Alliance for Personalized and Precision Medicine, Bulgaria, and our facilitator of the session, Mario Romao, EU AI and Global Healthcare Policy Director at Intel.
So good afternoon, everyone, and thank you so much for taking the time to be with us. I am Mario Romao. I work for Intel. I'm a policy director on healthcare and AI, and I'll be the moderator for this session. I'm actually thrilled to have an all-star, an excellent panel today to discuss AI solutions for better healthcare, from research to policy in Europe, with a focus in the European Union. We hear a lot about AI. We hear a lot about AI in medicine and pharmaceutical research and other areas of healthcare. And actually, we will try with this session to take the pulse of AI, so to speak. So I already would like to thank my panelists here that really have accepted to be part of this discussion. And I'll start by introducing our dear panelists. I will start by Dr. Professor Pravetoni. And I'll be giving a very short bio. Their bios are really too extensive, but here we go. Dr. Pravetoni is a full professor of general psychology on the Department of Oncology and Hemato-Oncology at the Medical Faculty of the University of Milano. And she's also the director of the Psycho-Oncology Division and director of the No Smoking Center at the European Institute of Oncology, where her research focuses on cognitive processes, decision-making, and error prevention. So welcome, Professor Pravetoni. Thank you to be with us.
Thank you very much.
You're very welcome. Professor Dennis Horgan, welcome as well. You are the Executive Director of the European Alliance for Personalized Medicine, EAPM, and the Editor-in-Chief of the journal Public Health Genomics. And he was actually a former director of the European Cancer Patient Coalition, a policy advisor in the European Parliament, and having worked with various international NGOs on health development projects. Dr. Horgan, also welcome. Thank you very much to be here with us.
Happy to be here.
Thank you. Dr. Nuria Malatz. Dr. Malatz is the head of the Genetic and Molecular Epidemiology Group at the Spanish National Cancer Research Center, CNIO. And Dr. Malatz's research focused mainly on pancreatic and bladder cancers. She coordinates several large national and international studies integrating different levels of information, including omics data. So Dr. Malatz, welcome. Thank you very much for joining as well.
Thank you, Mario.
You're very welcome. Dr. Jasmina Koeva is founder and chair of the board of the Bulgarian Alliance for Precision and Personalized Medicine. She's also a representative of Bulgaria to the European Union 1+Million Genomes Initiative. Her career actually expands from research in endocrinology to managerial positions in pharma, and actually having been counselor and head of the Bulgarian Trade and Economic Mission in the Embassy of Bulgaria to Vienna in Austria. So, Dr. Koeva, thank you very much. Happy to have you with us as well.
And thank you for this opportunity to join this event.
It's a pleasure. Michael Strubin. Welcome, Michael, Director of Digital Health at MedTech Europe, so the MedTech industry, which is the European Trade Association for all the medical technology in Europe. In his role, he helps develop the MedTech industry's voice in the digital health field and represents MedTech Europe's members vis-a-vis digital health policymakers and stakeholders. Michael Strubin, a warm welcome for you as well.
Thank you very much for the invitation. It's an honor.
Thank you. It's a great panel, and I will kick off without further ado. And I will start with Dr. Pravetoni with a quick question. I understand that you work on, amongst other things, on cognition and decision-making in support of patients and healthcare providers. So when we hear about AI, inevitably we think about decision-making as well, or at least decision support. So tell us a little bit, if you can, about your work and whether you think there is a role for AI, or which role is AI having, if any, at the moment.
Thank you very much. And just quickly, I like to say that, of course, AI is playing a role, and everyone is really very interested in understanding on which aspects of the job, and if the job of the physicians, of the doctors, will change on one hand, and on the second hand, if what is this for the patient? What is the added value of the AI for the patient? So you are right when you introduced me saying that it's a question of decision making. It's a decision making process, of course. And how we can describe in an easy way is like we have on one hand a roster, and that that is rising, and on the other hand the sun. So, but we need someone that gives us an explanation on the fact that interpret if the roster sinks because the sun rises, or the sun rises because the roster sinks. So when I see doctors that are worried about their future because someone said, "Oh, I don't understand how my job will change, and how, I mean, I can know how to use AI, and how could be important to use AI in my work, but I don't understand what is my role, which type of doctors I'll be with my patients." And this is, of course, a question of relationship. Someone who explains the added value of the AI for the patients, and on behalf of the patients, to better understand if this added value could be interesting or not for him in that particular situation, like the precision medicine, a personalized medicine, a personalized answer to that patient. And to really understand this, we need someone able to interpret this data and this work. So I always say to my patients, keep calm and don't worry, because we always will have patients able to help doctors in understanding and to interpret in the best way, to translate the advantage of the AI. And for what concerns my job, personal job, as a decision maker and psychologist, I'm quite sure that I will have a future.
That's fantastic. Thank you very much. And I once a colleague said, computers don't cure diseases, doctors do. And I believe in that. I think that's true. And the role of technology can only be help the doctors and the patients themselves to take better care of them, inevitably. So thank you. I will jump to Dennis Organ and piggyback on something that Dr. Pravetoni said, which is, you know, it's a collaboration effort at the end of the day. And Dennis, you are a key actor in all these collaborations and policy discussions in Brussels and beyond across the European Union regarding personalized medicine, right? So it's a collaboration amongst many different partners. So how is AI perceived? How do you perceive AI in these collaborations, and any highlights or lowlights that you want to tell us about from your experience?
Yeah, there's huge potential, of course, with AI, but AI is like a ship in a harbor. The question is, I mean, a ship in a harbor shouldn't be a ship. A ship is not a natural place for a ship to be in a harbor. It should be in the sea. So the question is, how can we apply these different technologies practically in a healthcare system more effectively? And the question is, of course, is with all new types of technology, it can appear disruptive. The question is the policy and regulatory and governance framework to support this. And this is a key issue that has been looked at the European level. At the European level now, what we've worked on is to develop a broad framework on personalized medicine, which is framed in the Council conclusions in 2015. And fast forward, we then developed another initiative called 1+1,000,000 genomes, how to empower data. And it was focused on called the MEGA project, Million European Genome Alliance. And why MEGA? Why million? Because it had a nice acronym, MEGA. We have a MEGA idea. How can we have a collaborative framework to empower data? Because the issue there is general data protection regulation focused on protecting data. But a key question for healthcare is to how to empower healthcare systems to enable them to treat patients better. And of course, this is a key question that some professionals, healthcare professionals, could be concerned. For example, dermatologists were concerned that the new types of scans, AI scans, that could see melanoma might replace them. So then dermatologists were less reluctant, I should say, to utilize these type of technologies because we were fearful of their jobs, I think, which Professor Pravetoni mentioned. But the issue there is, as with COVID-19 and telemedicine is more basic form, is how to interact with patients more effectively to enable the healthcare professionals to see more patients earlier, to diagnose them and treat them. So there's many different initiatives at the European level to focus on this. The question is, AI is a technology that can empower, but the question is the framework around to support this. And Europe is very concerned often around to ensure that there's a governance framework, for example, on the use of data. The same with the different types of technologies that are utilized. The question is, how can this be brought into healthcare systems at a quicker and faster pace? And this has been an issue that Europe has struggled on compared to other regions. We can look at different technologies around whether certain types of chemotherapy should be used for breast cancer, in terms of avoiding these type of chemotherapy, and there was a delay in bringing these type of technologies into different healthcare systems in Europe. So a huge potential of personalized of our AI, but the question is the framework to support going it forward. And now there's big initiatives. So the pharmaceutical strategy of the European Union, European Beating Cancer Plan, European Health Data Space, in vitro diagnostics, clinical trials regulation, and many more to keep us busy and awake at night. So I'll just stop there.
No, thank you. And you've mentioned one thing that I think I'll use when I make the next question to Dr. Malas. Is like the importance of data. At the end of the day, it's AI, and the results are as good as the data that is fed with. And Dr. Malas, you work in the field of genomics, and if I can think about an area that requires data, is that one, in the prevention and detection and treatment of pancreatic cancer. So tell us about your work, and is AI already a tool in your toolkit to fight cancer?
Yeah, hi. Indeed. Actually, I'm representing here the scientist component, no domain. So I have to say that AI and mainly machine learning and deep learning tools are used every day, every minute in my group. And this is because we want to analyze not only genomics, but also to integrate genomics with microbiome, with epigenomics, with metabolome, and also with non-omics data. And all of these poses several challenges, okay? And in this regard, we need very powerful technological platforms that can deal with a large number of data, storage the data, and also allow us to compute our risk models. So let me frame the problem rapidly and also the studies that we are performing. So the problem is pancreatic cancer prevention. What we want is to achieve personalized prevention of pancreatic cancer. And this is because there's only 20% of patients with pancreatic cancer that can be offered with a radical treatment, although it's not efficient for all of them. 80% when they are diagnosed is too late. The disease is already disseminated. So what we have to do is to go earlier in the diagnosis process and to perform screening programs. And to do this, we need to define very well the high-risk population for pancreatic cancer and have very good screening tests. So I'm in the field of the definition of high-risk population of a sporadic pancreatic cancer that represents 90% of the disease, the burden of the disease. So to do this, what we have started to do is to identify which are the risk factors for pancreatic cancer. As the colleagues that work on lung cancer, they do, and only with tobacco, they can identify the very high risk population for lung cancer. But this is not the case for pancreatic cancer, that it's a multifactorial disease. All the factors, the risk factors for pancreatic cancer contribute very little in the risk to this disease. So obesity, diabetes, chronic pancreatitis, tobacco, alcohol, etc. Okay. So to do this, we built a very large European-based study, case control study, and we gathered, we included 2,500 cases, 1,500 controls with very detailed data, epidemiological and clinical data. And then we also obtained biosamples from them. So saliva, blood, urine, toenails, tissue, and a stool. And from those samples, we generated all the biomarkers. So millions of biomarkers, as I mentioned you before. And we are dealing and analyzing those data all day alone, all the time, to identify the biomarkers and select those that help us to define the high-risk population jointly with the non-omics data. And again, this poses several challenges, and we need the support for sure, of funding agencies to do this, because it's quite costly, but also of technological companies to help in managing and in processing all of that data. So AI is in our hearts. Thank you.
And it's working, and it's an exceptionally huge problem, because indeed, as far as I understand, it's a difficult concept to treat. You've mentioned the technology companies, and this gives me really an opportunity to launch and look into Michael Strubin, which represents the medical technology industry, which for him, artificial intelligence, clearly it's not a novelty per se, but tell us a little bit about the role of AI in the medtech industry, and also how you see developing in the future, and how you see medtech industry using AI as well, their expectations, their hopes, and any concerns at the moment.
The medical technology industry, of course, is hugely engaged and hugely excited about the potential of AI. We did a study recently where we asked a consultancy to look at the potential impact, socio-economic impact of AI on European healthcare. And the results were just astounding. I think they calculated that for Europe, AI could save up to 400,000 lives a year. We could save up to 200 billion euros in annual savings, and that's an abstract number, but it would be more than 10% of the total European healthcare expenditure if you use 2018 as a baseline. What we're really excited about is the potential to really assist healthcare professionals and free healthcare professionals to focus on more demanding tasks. We calculated that AI could bring to the healthcare workforce the equivalent of about 500,000 additional full-time healthcare professionals. And if you've seen the news, healthcare professionals are leaving the profession in droves. We have a real workforce crisis when it comes to the pandemic effect, but also general workforce and demographic effects. That could really be a godsend. Now, that of course, and where do these AI technologies make the biggest? We looked into that as well, and we calculated that the biggest impact really will be on wearables. When we can equip patients and citizens with wearables to inform them about diseases, about their conditions. Diabetes is of course the case, but also step counters. If we can help prevent conditions or adverse effects like falls, that would really do us a great service, because we could save money that would otherwise have to be spent on treatments. For example, one of our member companies equipped people with step counters, and through crunching data we could find out that that one could actually predict when an old person will fall, and so could therefore intervene before an old person falls down and incurs some massive costs. Now, the other big area where AI can make a dent, of course, is with image and radiography, image recognition, where we can assist radiologists in identifying cancers and other conditions that affect us and cause massive issues and cause again huge healthcare spends. Now, this is all, of course, based on the premise that we could really deploy AI if to the extent that it's possible. But of course, there are a number of barriers. Many of you have heard that Europe is now in the process of developing AI legislation. I don't want to spend much time on that, but just with the observation that if we can't get this right, if there are concerns, and if society decides to put up barriers because it needs to, because AI can't be trusted, that of course would hugely impact the way we can deploy AI. The other big barrier, of course, also in the development from a regulatory side, is do we get the data to train and test AI appropriately? Because we as an industry hugely support the idea of regulation. We need regulation. Regulation is good, but if we over-regulate, that of course comes at a cost. There are a number of other barriers, but I think we can probably talk about this a little bit more in the discussion at the end.
We can, and I hope you will. And thank you very much. I mean, there are a few, actually many critical topics. One that I took note is the crisis on the healthcarers, so to speak. So in one area, at least theoretically, AI can help already a stretched workforce. They can kind of help those who are in the workforce. And if you mention another aspect again, which is the data aspect, and the AI Act, which is an EU initiative, and so apply to all countries. And here is my opportunity to go to Dr. Kueva, based in Bulgaria, and actually asking her a little bit, provide an overview of the reality of AI for healthcare in Bulgaria, And actually, how do you see it play? And I know, and I've mentioned, you are also very much engaged in the 1+ million European Genomes Initiative, this large initiative to gather many countries and many countries' genomic data. How do you see AI also play in that initiative?
Well, our focus today is the artificial intelligence in medicine, but of course, it's part of the overall ecosystem of artificial intelligence in a certain country or region. And with regards to Bulgaria, in paradox of the fact that Bulgarian IT specialists are known as one of the best in the world, and that the father of the computer, Jonathan Asov, is Bulgarian by origin, a survey of the Joint Research Center of European Union revealed that Bulgaria, unfortunately, is lagging behind of the other member states with regard to digitalization. It appears that artificial intelligence is part of the curricula of only 0.6% of the master degree programs, compared to 3.9% for the European Union. Bulgaria ranks as 12th country in the EU with regards to artificial intelligence, and leading branches are services 70%, followed by robotics 21%, and automatization 6%. So we are very happy that in order to catch up with the other member states, our government has already published its National Artificial Intelligence Strategy in December 2020, which has been based on the framework established by scientists by the Bulgarian Academy of Sciences, then worked out by experts of the Ministry of Transport, Communication and IT. And then it was a subject of discussion, public discussion, and finally released on the portal of the Council of Ministers as a concept for development of artificial intelligence in Bulgaria. It's really a very important document because it presents policy initiatives for the development of artificial intelligence in Bulgaria for the period 2020-2030, and offers a comprehensive policy vision for the development and use of artificial intelligence in Bulgaria, identifies main areas of impact being energy, biomedicine, biotechnology, healthcare, food, environment, and others. And you can see that actually medicine and related areas are identified as key areas for this implementation of artificial intelligence in the country. Speaking about the existing artificial intelligence structures in the research infrastructure in Bulgaria, we can divide the projects into two. We have advanced stage projects, like, for example, Center of Excellence in National University Complex for Biomedical and Translational Research, which is based in Medical University Sofia, and also projects in building stage, such as the Center of Competence Personalized Innovative Medicine, or the so-called PeriMed project, based in Medical University Plovdiv, which includes simulation training technologies in medicine, translational neuroscience, molecular and regenerative medicine, innovative diagnostic methods, pharmaceutical innovations for personalized medicine, and many others related to artificial intelligence and its implementation in medicine. Another center of competence that has been built is the Center of Personalized Medicine, 3D and Telemedicine, Robotic Assistant and Minimally Invasive Surgery, which is developed in Medical University Pleven and the Medical University Varna, with a focus on the implementation of NGS technology in genomic medicine in the field of hereditary diseases, genetic predisposition, reproductive health, cancer, hereditary and somatic tumors, precision and personalized medicine. There are other structures in the national roadmap for research infrastructure, such as the National Science Program on e-health in Bulgaria, cancer registry that has to be updated and in order to comply with all contemporary prerequisites for such a registry. The project Big Data in Digital Health that is coordinated by Sofia University, and of course, last but not least, the petascale supercomputer in Bulgaria, which is managed by the consortium Discoverer. Well, with regards to 1+mg, Bulgaria has signed the declaration towards access to at least 1 million sequenced genomes in the EU to 2022 in April 2018, just a week after the kickoff and the official signing of this declaration, and became the 14th member state signatory of this declaration. And since then, actually a lot of work has been done by the whole college, let's say, of country representatives. The kickoff meeting was in September 2018. Then a special group was formed by the European Commission dedicated to 1+mg. Of course, it has its representative from each signatory member states. Roadmap was adopted till 2022 with a very concrete steps and timeframes. And of course, Bulgaria is part of all these documents, as well as we take part in the project B1mg, which is beyond 1mg, the project that facilitates the operational part of this European initiative. And we recently joined the European initiative, the Genome of Europe. All these activities related to 1+mg actually attracted the attention of the institutions in Bulgaria, not only health institutions, but also the Council of Ministers. And in late September this year, we received the first grant for initiating the project, the reference genome of Bulgaria, as part of Genome of Europe, which is really a very positive sign, because on the background of all these political turmoils that take part in Bulgaria at the moment, such recognition of the importance of this project is really remarkable. We hope that this will go further, because we just had our last elections, and hope that we'll have a regular government, and all this prioritization of artificial intelligence, digitalization, and of course, genomic and personalized medicine will continue even better.
Thank you. Fantastic introduction. Thank you very much. You know, catching up in some keywords that I got amongst all your interventions. Research, we all spoke a lot about research, governance, data inevitably, and also decisions, right? This leads me, of course, you decide on data, you do research on data, and you need data governance. So I'm leading actually now to ask each one of you, or whoever wants to answer, actually, you all work with data in one way or the other. You based your work on data, and you decide upon data. And Dr. Maratz mentioned about billions of biomarkers of data points. My question is quite general, is that as access to quality data being an issue, And I'm asking this because it's a common complaint I hear across the board from industry, from practitioners, from researchers. It seems that there is never enough data. It is hard to get hands on the data. And it's also hard to get quality data. It's not like any data is useful. It needs to be quality, curated. And much of the European efforts have to do with actually setting up this European health data space that hopefully will create this base where data can be accessed and worked upon. From your current experiences, any comments that you might want to give on this? Do you have enough data? Data is enough? Do you have enough quality data? Whoever wants to pick first, and I'll try to split the question amongst all of you. I'm looking to every one of you at the same time. I can put to Dr. Malatz first, perhaps, just to kick off.
Yeah, sure. Yeah, let me say that we are very ambitious regarding data, and we always say that we don't have enough data for our studies. But then I have to recognize that we don't use all the data. Okay, so this is the first point. The second regards to the quality, and you are completely correct, fully correct in this assessment. We can build upon data with novel and beautiful algorithms with AI or whatever, but if the data is not correct, is not reliable, anything is superfluous. So results are not interpretable, and the studies are biased and with a limited results. No, so what I actually say to my people from the very beginning to the field workers when they go to the hospital, they collect data, is that their work is super important, even more important than the work that mathematicians and statisticians they do in our studies. So and now we are moving from collecting data through the very classical ways, approaches, to the more novel approaches using e-medical records and wearables, as Michael also commented, and etc. But still, no, we are concerned about the reliability and validity of the data. It's the image of the target, no, the Diana, no, the Diana, that we want to have data that actually touches the center of the Diana every time we apply the same system.
Exactly, and that's one of the causes that then we hear about biased results, or results on the algorithms that really don't get to the point that we want them to be. But Professor Pravatoni, decision is what you do and help decisions. So where does the data come from? Where are you based? Is that enough data? Would you like, is data from you work in Italy? Is data from Italy, or is the data upon you based your work coming from other sources, from other countries, from other EU countries, or eventually even beyond? Is that enough?
Okay. Oh, the data are not really enough if we focus only in Italy, or it depends. For something could be for some type of breast cancer, for example, but they are not really enough as we need to play a game on the decision-making process that is completely related to a reasoning on the data. So we are trying to help the patient in this process, in the decision-making process, to understand that we have different options, and these options can influence their decision. So we just try to advocate with the patients that most of the time we make some decisions because of the emotional or the cultural influence in making that type of decisions. That we need to concentrate on data, and we don't have at the moment enough data, so we need to include a level. We need to use a major level that is an European level of data. And in this, we need to help the patients in understanding that there is another culture, that could be that there are other results or suggestions. And so what I'm trying to say is that making a decision has two big aspects. One is the evaluation of the emotional and the feelings and the culture of the patients that could influence in a certain sense. And the other one is that the logic and the reasonings coming from these AI data that we need to work with other people.
No, absolutely, and that seems to be a pattern. There is data indeed is not enough, and for it to be enough, eventually governance is a keyword that needs to be there. And I would now look to Dennis, right? What does Europe need in terms of health data governance to be successful and to be able to provide data to Professor Pravetonia, Dr. Magarts, Dr. Cueva, and industry? Which governance? You know, this is what kind of, as I say, a $1 million question. Dennis, would you like to, you know, challenge us a little bit? What are your views?
I mean, I think the question, I think Nuria set up right. I mean, there's a lot of data there, but big data. But what is big data but a lot of small data put together, which is big data, essentially. And the question around data is, because of better technology, analytical tools, we can derive more value from the existing, we can derive more knowledge from the existing information to translate this knowledge into a value. And this value can be value to patients in terms of early diagnosis and better treatment, better value to the scientists in terms of how to develop the research, a better value to the payer in terms of making a decision about reimbursement, say a different diagnostic technique, and a better information for the policymakers. And this can be reflected in COVID-19 as well. I mean, how in terms of all the data that was collected in terms of the COVID-19, in terms of the disease burden, where there's different incidents of COVID. The question is, how is this information collected and shared and interpreted? And this issue also links also to the medical guidelines. So from the governance guidelines, from the ECDC, the European Centre for Disease Control, produced guidelines. So the issue around around this data, then the question is, how is these guidelines, for example, if I take the COVID example, implemented? So in different countries in Europe, the guidelines were implemented different ways. And then you have different types of technologies that different public health sectors, workers were they were typing it in. I mean, the question is, how can you apply these different types of technology in a more effective way? Or I asked a doctor, can I go and get my vaccine? And the doctor said, can you fax me some details? And I said, well, I don't have a fax. And the doctor asked me, where am I? And I said, I'm in the 21st century. So the issue there is around the governance. Around the governance framework. The General Data Protection, for example, had over 4,000 parliamentary amendments. So there's 4,000 different opinions around the General Data Protection Regulation. The question of the European Health Data Space, which was in its infancy, the 1 Million Genome Project, because it was really about how to have interoperability. The question is the governance framework around this. The issue with policymakers and regulators, they need to also to facilitate that. They need to support the areas around public-private collaboration, cooperation, to derive the benefit from these technologies into healthcare systems. Of course, General Data Protection Regulation is a very strong tool to ensure, and it's an added value for Europe, that we have good data protection laws. But the question is, we don't want to hinder innovation we brought into healthcare systems. So what is the broader governance framework to do this? And the issues there are basic issues that we should look for, low-hanging fruit. How is data collected in a structured manner between different healthcare systems for different, for example, in cancer, in different tumor types, maybe pancreatic cancer? How can that data be utilized by different types of sectors, say joint clinical assessment, if you look at the health technology assessment, how is information utilized? So key issues for in terms of governance framework is a practical implementation, how to tackle the implementation gap. So then there is value to the patients, value to researchers, value to the scientists, value to policymakers. There's a lot of issues are talking about AI, which seems like far off. But the question is, it shouldn't be artificial intelligence, it should be real intelligence. So we want real intelligence to be applied in a real world way to have an evidence to support clinical decisions. And then linked to Professor Pravatoni, what are the decision-making frameworks to support that? Because of course, you can have all this information that derives from if you sequence your genome. But the question is, how does that apply in practice to the patient, to the citizen? So how is this value to this patient and citizen? So these are questions which have been tackled since time ago in terms of treating a patient, diagnosing a patient, but this is just better technologies how to do this. So we shouldn't be scared about these type of technologies. The question is the framework to support that, and this is the broad governance framework. Europe recognizes that it needs a broad governance framework to support this. It cannot just be one member state or one big country. It needs to be a collective effort. Linked to personalized medicine is that diseases are divided up in so many different diseases that we need a body, we need a broad European approach between all citizens then to have a joint up approach so we can tackle this effectively. I'll stop there.
But while Michael, your views regarding data, governance of data from the industry point of view. Industry is a consumer and a provider of data, as many other entities as well. What's the main issue that you see there, and what can industry do to help?
I think we've already heard quite a bit, and I agree with every single thing we've heard regarding our legal barriers that we've had, GDPR and so forth. I mean, the thing that just struck me in the last couple of weeks or so was at some point a presentation where somebody, a smart guy, talked about the data situation in the country of in the region of Catalonia, which many of you agree is probably one of the most advanced regions when it comes to data and to digital health in Europe. And the office went out and looked at data and found that there is in every single hospital at least 400 different types of data silos. In some hospitals, 800 different types of data silos. So even in a region that has been really at the forefront, you have a vast amount of places where data is stored in incompatible format, where data can't be moved. And so that requires now a huge set of cleanups. And I think and a huge investment and huge effort in terms of bringing all of this together. So we have a huge, on the one hand, some legal barriers. We need to really tackle the issue around data governance, making sure that we appropriately balance data protection with powering innovation. But we also have a real practical issue, which is that people have been gathering data in their silos and in places that are just in a proprietary formats, and really have not been wanting to share data. And for a long time, this has really held us back because nobody really cared. People didn't really seem to want to share data. So the fact that there were legal and technical barriers, they kind of seemed to cancel each other out, and we were all stuck in a kind of a Mexican standoff. Now that the European Commission, that many national and regional governments have discovered that data is actually as a resource that should be used, that should power, that should fuel, that should energize research and innovation, and secondary use. Now we're really starting to slowly uncover kind of the sad story of where we really are at with data. So we as an industry, we very much support work on health data governance. We very much support work on cleaning up these health data silos. Very often this requires work on the public sector side, where data is really often used, often stored. It also, of course, requires work on the side of our own industry here, but where if we want to, as an industry, say we want to have access to this data that comes from public sector, we of course also need to find a way to share data that is generated. Because as I always like to say, is the medical technology industry really is at the heart of the health data ecosystem, because it's really the devices, the sensors that are made by our industry that produce this type of data. Nobody cares about Fitbits and other consumer devices. People want to have data with medical grade accuracy and validity. So that's really our industry. So we are at the heart of the industry, of the ecosystem. We also, of course, want to benefit and access data so that we can develop new technologies that benefit patients and citizens down the road. And this will be a really exciting journey in the next few years.
Thank you very much, Michael. And indeed, COVID, one thing that it brought at least was a reality check on how difficult it is to actually have data, at least across Europe already, if not to talk across the world. Just before going to Dr. Cueva, and I want to thank Professor Pravetoni. She needs to leave, take care of patients, and she do well so. So thank you very much for your presence. Will be with us.
Thank you very much.
Thank you very much. Bye bye. Thank you. We'll stay, if you can, a little bit more. Everyone else, about 10 minutes or so. And Dr. Pravetoni, please do leave when you wish. And Dr. Cueva, going to and still being on the data discussions. And if you like, do any considerations regarding the 1 million genomes. At the end of the day, you need to gather exactly what it says, 1 million genomes. So it's lots of data. Any discussion? So how is this going to happen, or any topics that you might highlight?
Yeah, it's actually a very difficult task because most of the data is not compatible with one another as a storage source. As well, it depends on the quality of data, it depends on the methods of analyzing the data. And that's why within the project 1 million genomes in EU till 2022, there are actually 12 working groups, each of them working on a certain topic. And 3 of them are working exactly on this in order to create a common standards on quality and how data is stored, how it's processed. And even they've made already a synthetic model on how data should be shared and what would be the access, who will have this access to the data, who owns the data, because this is an important issue as well. And all this LC, ethic, legal, social aspects of sharing data. And I think that really because okay, the process was a little bit slowed down by COVID, but anyway, there's a lot of work already done, especially in this regard, to have a common standards, to have interoperability in the storage of data and compatibility of sharing that data.
Thank you. And jumping to wrap up, I would like to ask you a question, a bit, let's say, looking forward. So, if you could make a wish, and since Dr. Cueva, you are speaking at the moment. If you can make a wish for 5 years, what you would like to see happening or have happen in 5 years time in the years that we are talking about?
Well, you know, some of the futurists say that the future is already here, but it's not evenly distributed. So my wish would be my country to have the future or the nowadays future in place within 5 years, and to take the full advantage of all the potential of the artificial intelligence in medicine. In order to have the implementation of all these that we have already in place in some countries, but for the benefit of the citizen and the society.
Everywhere. No,
Everywhere.
It's a great point. Thank you.
Yeah.
Thank you. Thank you very much. And Dennis, in 5 years, from where your standpoint, Europeanized personalized medicine, precision personalized medicine, where should Europe be in 5 years? Or where you would like it to be?
Europe should be still here, stronger as ever, I hope, as a strong economical region. What I would like to see in healthcare is more of to marry the idea of population-based healthcare and personalized medicine. So having a more population-based approach, a public health approach, a public health genomics approach to bringing this type of technologies into healthcare systems. Because now we have very much a segmented based approach, focusing on different diseases in different areas. What would be good in terms of utilizing AI and data is having a population-based approach, saying how do we identify patients earlier and treat them better and more effectively. And this has been done in different screening programs, primarily in cancer, in colorectal cancer, breast cancer, cervical cancer. But now we're pushing for the European Beating Cancer Plan for lung cancer and prostate cancer. But this could be applied not only in cancer across different diseases, the same in AI, same in Alzheimer's disease and related dementia. We can have better biomarkers to identify patients earlier. So my hope is to have a population-based approach with the utilization of data in a secured framework, according to the values of Europe, and more public-private cooperation to bring value to their public healthcare systems through private sector cooperation to empower them more effectively. And that is a hope, which I hope will be realized in the next 5 years. I know you're always optimistic, Mario, so maybe in the next 10 years, I would hope. And that it will not be just a lighthouse in certain disease areas where it just flickers, but a light across Europe. So we have more effectively distributed and a quality of access for diagnosis and treatment.
Thanks. Let's aim at the 5 years. It might get delayed a little bit, but let's have that goal. And I can just imagine, my guess is, Dr. Magalhães, you would not disagree with what Dennis just said, but in 5 years' time, what you would like to see achieved or done?
Yeah, I think that Europe should invest more in primary and secondary prevention of cancers, and mainly for those cancers that cannot be controlled through treatment. Breast cancer is increasing in incidence, but we can control it because treatment is very successful. However, there's other lung cancer or pancreatic cancer that we need to apply more preventive strategies. So to do that, I think Europe should invest in building large resources, large studies with common protocols throughout across European countries, that we all gather similar type of data, very reliable and validated data, clinical, epidemiological, also related with biobanks, in medical records, with wearables, so that we can all apply or can we all validate our results, biomarker results, through the same in the same population study, no? And this will help us in building all together towards the personalized medicine, and to avoid the silos that have been mentioned, and to be more transparent in all our research purposes.
Thank you. Research at EU scale, at the scale of the EU. That makes lots of sense to me. And Michael, we'll end with you. What is the wish list for the medtech industry and in 5 years' time?
Well, there is the entire discussion about the European health data space is really conducted, I think, between two poles. I think one of them is represented by kind of like the industry, the friendly industry commissioner on the one side, and I think the health commissioner more on the patient side. So there's a pole between the potential and for innovation and let's use data, and the other one, the more conservative, the more cautious one, saying, well, but what about the patients? What about the citizens? What about the sanctity, privacy, and all of that? And between those two poles, we need to find a middle way. I mean, the worst could be that we kind of muddle through, that we don't have a clear line. And so there is, if I needed to look into a crystal ball, so I couldn't predict where things go, but my wish list would be that we're going to take this bull by the horn, that we see the possibilities and the options, that we of course do not forget the concerns and that we do care about patient protection, citizen protection. I think Dennis said it right. I think the GDPR is a huge opportunity, but we now need to meet the promise of the GDPR, which is to have a consistent legal framework, really agree on solid rules, but then really be done with it, make sure that we comply with them. But on top of that, build AI, build data, the data space that really, that really advances the potential for research and development. And in if all works out, so we're there.
It's a huge wish list, but it's the one that I believe Europe needs, and I totally agree with all of you. Let's try to set the next discussion in 5 years' time to see how we all, if we all manage to tick the boxes. So,
excellent idea.
Excellent idea. So, with this, I want to thank you very much for your time. I think it was a great discussion. And thank you also to the audience to have been with us. So I want to wish you a good evening to all of you.
Thank you.
Bye-bye.
Thank you.
Bye-bye.
Bye-bye.
Thank you. Thank you, everybody. Thank you, Mario.
You're welcome. Thank you for joining. Bye-bye.
A big note of appreciation to all the panelists for this wonderful and informative session. We look forward to the future with hope.